I'm going to talk about the virtual dermatology. So I have a startup that's called Dermato Virtual, but I think first it's important to explain something about the teledermatology because I think there's a lot of students here. So let's go. This is my presentation. You just made that before. So I'm dermatologist with 23 years of experience, but mainly on my office. So for me, it's very new and experience to be an entrepreneur and be the founder of Dermato Virtual. So what's the teledermatology definition? Is the dermatology made in a different way, not presential, using telecommunication. So you can share your history, you can share audio, visual, and data communication. So dermatology online now it's the most popular application of e-health and telemedicine. The history of teledermatology is very old. So the first report was on 1967 in Boston, but the first time that the name teledermatology emerged was in 1995 with two dermatologists, Peridine and Brown. So since 1995, we have the practice of teledermatology in some countries like USA, Canada, but not in Brazil. So in Brazil, it's something that's really new. Why dermatology is so suitable to the practice of telemedicine? Dermatology is a visual field, so it's very easy if you have good pictures. And nowadays we have a really modern smartphone that gives you good pictures. It's very easy for us dermatology to make a diagnosis. So I think it's almost 70, sometimes 80% of accuracy if we compare presential diagnosis with an online diagnosis. But it's really, really important to have good pictures. And among all the specialties, dermatology is considered the fourth suitable for the practice of telemedicine, just after radiology, pathology, and psychiatry. So in teledermatology consultation, you can have your skin, hair, and nail problem diagnosed. You can check a suspicious spot on your skin. You can maintain treatment. This is really important. The telemonitoration of chronic disease. So you can very easily make the follow-up of this patient psoriasis or atopic dermatitis without the necessity of the patient be presential. So it's really a very important decision to make a teledermatology of chronic disease, mainly with lots of patients living outside big cities, and they don't have easily access to the dermatologists. To prescribe medication in case we need, and receive dermatology care when it's convenient to you. So these are the main disease that we follow in dermatology, in teledermatology: rashes, all kinds of rashes, acne, eczema, psoriasis, and mainly suspicious spot or moles. So what's the limitation? Of course, we have the limitation. It's not everything that is 100% and it's good. And it's really important to know the limitation of this specialty. So the limitation is you can do the body total mapping in your skin with teledermatology, because you cannot have in both sides, and these sides with the general practice or the nurse, they don't have normally a machine to make the total body mapping. So this is really difficult to do. You can check an isolated lesion, that's great, but not the total body. Another is a hairy area. So it's very difficult to make a diagnosis if the patient take a picture of your scalp and with hair or the trunk. So normally you have to ask them to shave before taking the pictures. Pigmented lesion. This is very challenging because normally we need a device called dermoscopy. But if you have the dermoscopy on the other side, it's much better. But if you don't have, as I say, it's better to have a normal picture made by a smartphone than having nothing, because for many years, the diagnosis of skin cancer was made using the ABCD, asymmetry, border, color, and dimension. So, of course, if you don't have a dermoscopy, it's okay to have a normal picture and send to your doctor to give you some orientation. And lesion on the mucous area is very difficult to visualize. So these are the limitations. What's the advantage? Like in Brazil, most of countries in the world has a very shortage of dermatologists. If you can see here in Brazil, the light blue areas is the area that you have less than one dermatologist for 100,000 patients. So the shortage and the locations are concentrated in big cities. In Brazil, for instance, 60% of dermatologists are concentrated in 39 of the 5,500 cities. So most of the doctors are here in São Paulo and Rio de Janeiro. So the advantage is this, that to try to fix the imbalance of this, the flexibility, the flexibility of the schedule for the doctors, and the cost of investment for young doctors, that we know that it's very expensive to rent a place, to make everything perfect, secretary and all the bills that you have to pay when you have your office. And if you do this online, you can do in your house. So it's you don't need to take the traffic jam to go to your room. So it's really an investment. So decreasing emergency rooms, high resolvability of the cases, high agreement between non-presential and presential, and great patient satisfaction. So this is the virtual care dermatology. These are the countries and the number of published studies in dermatology. As you can see here, before COVID, we only had 85 results in PubMed if you put the word teledermatology. After COVID, we have 433. So we had an increase of 400 published articles after COVID. So these are all the articles that if someone has interest, I can give later. So I'll be fast here so we can have time to discuss about. So teledermatology, I say it's dermatology, but made in a different way. So it's all the same. The patient data and the clinical story, you have to know the identification, name, age, race. You should have a signed consent form. So all the complaint is very important for a dermatologist when the disease started, the onset of symptoms, location, family history. So it's like a presential, but you were doing that online. So what I mean, in my experience, because I know there's a lot of students here. So teledermatology, your patient is your partner. Sometimes you need the patient to help you to make a better diagnosis. So like here, this is a psoriasis. Sometimes young doctors are not 100% sure of the diagnosis. And so you can ask your patient to help you. So you can ask the patient to scrape or rub the lesion during the consultation, during the video consultation, and take a picture so you can see the bleeding deal sign. Another example of this is dermatofibroma, that sometimes you can misdiagnose this as a melanoma because sometimes it's darker than this one. So you ask your patient to do a compression on the sides, and this is a dimple sign that for us dermatologists, it's like almost pathognomonic of dermatofibroma. That's a benign lesion. This is a lichen planus, so you can see the Koebner phenomenon, that is a appearance of the lesion in a trauma. So all these help you with the diagnosis. Like this, pityriasis versicolor, that's a very common mycosis fungal disease. Sometimes you see the lesion and you don't see this scale, this desquamation, and you ask the patient to make a stretch on the skin, and then it's easy, pityriasis versicolor diagnosis. So you have a partnership with your patient, and that's very important. So I'm not going to repeat, good images is fundamental for us dermatologists. Good pictures, normally in 3 incidents, close up, a little bit far away, and with some inclination, so you can see if the lesion has an infiltration or not. So partnerships between doctor and patient is important. So these are a guideline from UK showing how should be the pictures. So this with focus, no focus. So normally three pictures is enough for dermatology. So this is, we have a technical guide for teledermatology. I'm not going to give the details. If someone wants, I can share the slides. So lighting is important. The images are very important for us. So it's not good for dermatology to do online only with video. You need pictures also. So all these are very important for us. So teledermoscopy, what's teledermoscopy? And when you use a dermoscopy attached to your phone, because you can have a 10-fold magnification. So this nowadays is very important, mainly to make the diagnosis of triage of benign or malignant lesions, skin cancer. So it's IoT is a device, so it's really important nowadays. Most of people ask, which platform should I use? So you have all generic platforms. We have the HIPAA compliance conference, that is the healthcare Zoom, WebEx, Teams, generic platform, and specific platform that in Brazil is Dermatovirtual, that I am the founder. And you have another one in USA, Dermatologia Oncolo, First Derm, SnapMed, Direct Derm. They are all specific platform for dermatology. So this is the requirement that all the platforms should have. So we had a very interesting project here in Brazil that was made in Einstein with teledermatology, asynchronous teledermatology, not synchronous. So the patient was taking a picture and sent to a dermatology to give the diagnosis. And what they want to know, if the doctors really trusted in online consultation. So before the project, only 33 were confident and 25 overconfident. After the project, 83 were overconfident and 17 were confident. So showing that dermatology is really a good option. So this was the project. They studied 65,000 patients in a synchronous telemedicine, and they reduced the waiting time of 6 months to less than 1 week. And it was done in a small village in São Paulo. So this is Dermatovirtual is a platform of teledermatology where you have a app, iOS for Apple, and you have the Play Store, Google. So the patient can choose your doctor, the schedule, and he can schedule his own consultation. And in the day and the time, the doctor will be there. The doctor receives the pictures first. And so I told you that the pictures are really important. And nowadays, we have 2 projects in Brazil. We have a lot of projects, but in this moment, we have acne. Because why acne? Because 15 to 16 million people are suffering from acne. 9% of teenagers will have acne in any moment from 11 and 20. And why acne? Because acne, most of people think about, oh, it's beauty, it's not disease. No, because it's the #1 consultation, and it's affecting a lot of teenagers with depression, social isolation. So, and it's for us dermatologists, it's the easiest way to treat. You can treat the acne online. You don't need to see the patient. You can see the patient, but if you need to treat 6 months or 1 year, you can. And I have been treating lots of patients from a small village, really small village, that they don't have access to dermatology. It's 4 hours by car to reach the specialist. So it has been very nice and great to know that I'm helping that teenagers. And another project that we are starting now is a triage of lesion, because we know that skin cancer, 30%, 1/3 of the cancer are from skin cancer. Basal cell carcinoma, squamous cells, and of course melanoma. That is it's really terrible because it's really very deadly. So we have to do the triage, and it's very nice if you can make an early diagnosis and send the patient to biopsy or surgery. So very fast, AI in dermatology. The application of AI are enormous, so they help the doctor really they enhance the diagnosis, they enhance their accuracy. So it's very, very fast here how it's done. You should have millions of pictures, so you can train the machine to give you a more accuracy in your diagnosis. So these are all, I'll be very fast here. So this is the overview. The clinical application is augmented assessment. Dermatopathology is really great, and teledermatology. So most of the articles show that when the human being alone, you have a accuracy of 81, 42. So sorry, because this is all GPs or young doctors. So when you take the GPs, the general practice, and the AI, it enhances to 83. So from 81 AI alone, when you combine human beings, the doctors, with AI, it enhances to 83. So it's a really nice tool to help to enhance the accuracy of the diagnosis. So we in Brazil, I am one of the authors, we have already, since last year with Professor Shaw, we made the guidelines for the good practice of teledermatology. So our society, the Brazilian Society of Dermatology, Brazilian Board of Dermatology, we have this. It's really nice for the young doctors to know, since the legal part of LGPD, everything that I talked today about the importance of the pictures. So it's a really nice guideline that we created last year. So these are some companies that they have AI. In Brazil, it's not allowed. The legislation here is still being studied about AI. So this is some company that they have the diagnosis on AI. The patient can have the screenshot. And this is a very short. Do I have time? 30 seconds.
Meet our AI-powered dermatology
just to show
tool.
very fast.
Go ahead.
Marked medical device that uses machine learning to help find answers to common derm conditions right from your smartphone or computer. From your phone, just upload 3 different photos taken from various angles of the skin, hair, or nail issue that you want to learn about, and answer some basic questions about your symptoms. The AI model handles the rest. In a matter of seconds, you will have a list of possible matching dermatologic conditions, and then we can help you get relevant information to learn more. It seems simple, but developing an effective AI model for dermatology requires the capability to interpret millions and millions of images, inclusive of a full range of skin types and tones. When available, this tool will be accessible from your browser and cover 288 conditions, including 90% of the most commonly searched derm-related questions on Google.
So this is a Google app. So this is great. They are still studying because they are all done in light skin color, so have a lot of bias when we try to use this, like in Brazil, that you have a mixed all kind of colors of skin color. But this is great, and this will be the future of I think most of the specialty where you have a image like radiology. We know that is a great success, but skin, we can have this maybe in 5 years. This will help a lot the doctors, the general, the GPs, small village where you don't have specialists, so that's great. So what I want to tell is that technology is not going to replace the doctor, but it will certainly replace the doctor who does not use technology. So this is what I want to give this advice to the young doctors, to the students that are here. And so that was my presentation. Thank you.